Apotti has been built to prevent human mistakes. So, for instance, in medication workflows, Apotti guides the nurses to give the medications to the right patient, the right medication at the right time. And we have already seen reductions in medication errors. We used to have dozens of information systems that the professionals used, and we actually estimated that 1/3 of physician time was wasted on just searching information from various systems. We provide an integrated tool for the physicians and nurses and social welfare professionals so that they can see all necessary patient and client data when needed. This is particularly important in cases like intensive care and emergency departments where all information needs to be available without any delay.
We needed a very strong partner. We were a young company at the time when we chose our IT provider. We were building a very huge IT system. So we needed a strong, big company with a lot of expertise in different areas. Fujitsu's solution consists of several technologies, and we wanted to have a partner who is able to bring them together and provide them as a service for us.
The benefit for the patient is that their information is available no matter where they are being treated.
Trust is crucial. We are dealing with people's healthcare and social care information. So our customers, they need to trust us as a vendor, and we must trust our vendors like Fujitsu 100 or 110%.